We are here today to bring awareness to the Filipino culture. And we would like to ask you a few questions about the religious beliefs.
Sure.
Okay, tell us about the dominant religion in Filipino culture.
About 85% of Filipinos are Roman Catholic.
So, if there is a Filipino patient in the hospital and the family needs to make end-of-life arrangements for the patient, what are some things the nurse needs to take into consideration?
Well, first, we believe planning for one's death is taboo and consider tempting fate. This is also one reason why we do not care to talk about advanced directives in the hospital or living wills. When and if a death happens in the family, they will know what to do to make sure it is taken care of. And it doesn't necessarily need to be a quick process. Sometimes after death, the wake may take anywhere from 3 days to a week, waiting for the arrival of family members in other states.
I see. Tell us about how the family will make sure to care for the member who passes. For instance, how is the body prepared? Do they donate organs?
Oh, no. We follow Catholic traditions and believe that keeping the body intact as much as possible after death to prepare for the afterlife. Organ donating is not an option, unless perhaps there is another family member who is involved in needing the organ. Then maybe, but it is a tough decision. Before the passing, a priest must be called. And it is important for the hospital to know not to remove any religious medallions, rosary beads or religious figures from the patient or bedside.
Now let's talk about babies. What about when they get sick?
Well, illness in babies may be attributed to the evil eye that someone has put on them, like a curse.
Okay, so the evil eye sounds like something that could be taboo. How about what Filipinos view as taboo in their culture?
Well, divorce is illegal. Abortion is a sin, and the only acceptable form of contraceptives are natural family planning. Naming the baby before it's born or after a dead person may affect the baby with bad luck.
So, when someone gets sick, do they automatically go to the doctor?
No, they may try and treat it at home with herbal remedies. We have traditional healers, called Hilot, who is often willing to go with the family to participate in medical treatment.
What will the Hilot do?
They provide support for the patient, special prayers that will be incorporated into the treatment to give the patient a sense that all available sources are being used to treat the illness.
How does the Filipino patient define health and illness, maintain health, and what methods are used to treat illness?
Many Filipinos may just accept minor ailments because they are considered natural occurrences that will resolve once they have run their course. Therefore, do not be surprised if a Filipino patient takes their time when seeking health care, because they will not do so until the illness is quite advanced. Also, Filipinos are fatalistic, tending to accept fate easily, especially when they feel they cannot change a certain situation. Decisions about when, where, and from whom to seek help are largely influenced by the intimate circle of family.
Will a Filipino seek care sooner if they are in pain?
Patients will not complain of pain even if there are physical indicators, because many view pain to be a natural part of life. For a Filipino, living with pain is seen as living an honorable life, as an opportunity to atone for past actions and opportunity to reach a full spiritual life. Emotional problems are talked over with family members to avoid involving outsiders to decrease uncomfortable feelings.
How would you know if your patient was in pain?
You would need to carefully monitor for any signs or symptoms of pain.
Are there certain topics that Filipinos may be particularly sensitive to or considered taboo?
Sexual education and sex are not discussed openly within the family. Homosexuality is more common now, but it's still seen by some as a deviant behavior, so it may not be discussed among more traditional members. Filipinos consider abortion to be a sin and do not like to discuss it. And again, planning for one's death is also taboo.
What are the attitudes toward mental chronic disease, death and dying?
They do not share information with outsiders about mental illness, divorce, terminal illness, criminal acts, and AIDS or HIV. Mental illness is believed by some to be hereditary or linked to many external causes such as witchcraft, soul loss, or spirit intrusion. Emotional and physical discomfort feelings may be kept to a minimum also.
Are there particular methods used to help maintain health?
A high value is placed on personal cleanliness. Keeping oneself clean and free of unpleasant body odors is viewed as good for one's health. It is considered shamelessly irresponsible to be disorderly in appearance. Aromatic bathing is done to restore balance. Some believe that after strenuous physical activity, rest is required before a shower to avoid developing arthritis. Traditional Filipinos believe colds, fever, rheumatism, pneumonia or other respiratory illness may arise from exposure to sudden cold temperature.
Are there particular methods used by the patient for treatment of an illness?
A few methods include consuming garlic daily to combat hypertension, ginger root to relieve sore throats and promote digestion, and melon is eaten to prevent diabetes. They eat greens and stews to regain stamina for someone believed to be anemic, and calcium in the diet comes primarily from green leafy vegetables and seafood. Medicinal household plants are kept and used in treating the common cold, upset stomach, urinary tract infections and other minor ailments.
Wow. Those are some interesting methods. What about medications though?
Medications are also taken for illness. However, you would want to monitor the effectiveness of the drugs due to resistance or insensitivity related to availability from lack of regulation of them.
Is there a person in the family responsible for health-related decisions?
Filipinos depend on immediate and extended family during illness for assistance and support. The mother in the family has a major part in healthcare that includes caring for sick during illness. Doctors are often referred to for major decisions more than the collective family.
Thank you so much for your time today, nurse. And I would like to introduce our next video about nutrition. Yum.